Cancer of the throat symptoms? Cancer may be a class of diseases during which abnormal cells multiply and divide uncontrollably within the body. These abnormal cells form malignant growths called tumors. Throat cancer refers to cancer of the larynx, the vocal cords, and other parts of the throat, like the tonsils and oropharynx. Throat cancer is usually grouped into two categories, pharyngeal cancer and laryngeal cancer. Throat cancer is comparatively uncommon as compared to other cancers. The National Cancer Institute estimates that of adults within the United States, about 1.2% are going to be diagnosed with mouth and pharyngeal cancer within their lifetime. About 0.3% are going to be diagnosed with laryngeal cancer within their lifetime. Throat cancer happens when cells grow in an uncontrolled way partially of the throat. Treatment is feasible, but the outlook will depend upon where cancer starts and the way soon an individual receives a diagnosis. It can affect the larynx, voice box, and either the upper or lower part of the pharynx, throat. As cancer spreads, it's going to grow into nearby tissues. However, the name of the cancer will always depend upon where it starts. The National Cancer Institute (NCI) classify throat cancer as a head and neck cancer. It shares some features with oropharyngeal cancer and mouth cancer. It can affect both adults and youngsters. It is relatively rare. Consistent with the NCI, the lifetime risk of developing cancer within the mouth or throat is around 1.2%. In 2019, the NCI estimate that 53,000 people will receive a diagnosis of oropharyngeal cancer, which incorporates throat cancer. They expect 10.860 people to die from this disease in 2019. In adults, exposure to tobacco and therefore the human papillomavirus (HPV) increase the danger. This article will check out some common types, causes, symptoms, and coverings of throat cancer and therefore the outlook for somebody with a diagnosis. The signs and symptoms of throat cancer could also be difficult to spot within the early stages of the disease. Many symptoms related to throat cancer, like a pharyngitis or hoarseness, are an equivalent as people who may accompany a chili. Throat cancer may be a sort of head and neck cancer. Throat cancer has different names, counting on which a part of the throat is affected. The various parts of your throat are called the oropharynx, the hypopharynx, the nasopharynx, and therefore the larynx, or larynx. The main risk factors for throat cancer are using tobacco-heavy drinking. Certain sorts of throat cancer even have other risk factors. For instance, having HPV may be a risk factor for oropharyngeal cancer. Symptoms of throat cancer may include pharyngitis that doesn't get away, a lump within the neck, pain or ringing within the ears, trouble swallowing, ear pain. To diagnose throat cancers, doctors may do a physical exam and history, imaging tests, and a biopsy. You'll also need other tests, counting on the sort of cancer. Treatments include surgery, radiotherapy, and chemotherapy. Treatment for a few sorts of throat cancer can also include targeted therapy. Targeted therapy uses drugs or other substances that attack specific cancer cells with less harm to normal cells. Although all throat cancers involve the event and growth of abnormal cells, your doctor has got to identify your specific type to work out the foremost effective treatment plan. The two primary sorts of throat cancer are squamous cell carcinoma. This sort of throat cancer affects the flat cells lining the throat. It's the foremost common throat cancer within the US. Adenocarcinoma. This sort of throat cancer affects the glandular cells and is rare. Two categories of throat cancer are pharyngeal cancer. This cancer develops within the pharynx, which is the hollow tube that runs from behind your nose to the highest of your windpipe. Pharyngeal cancers that develop within the neck and throat include nasopharynx cancer, upper part of the throat, oropharynx cancer, middle part of the throat, hypopharynx cancer, bottom part of the throat, laryngeal cancer. This cancer forms within the larynx, which is your larynx. Staging throat cancer. If your doctor finds cancerous cells in your throat, they're going to order additional tests to spot the stage, or the extent, of your cancer. The stages range from 0 to 4. Stage 0, the tumor is merely on the highest layer of cells of the affected part of the throat. Stage 1, the tumor is a smaller amount than 2 cm and limited to the part of the throat where it started. Stage 2, the tumor is between 2 and 4 cm or may have grown into a close-by area. Stage 3, the tumor is larger than 4 cm or has grown into other structures within the throat or has spread to at least one lymph gland. Stage 4, the tumor has spread to the lymph nodes or distant organs. Symptoms. There are many various sorts of throat cancer. The symptoms and progression will depend upon the sort and site of the cancer. Common early symptoms of throat cancer might include pain or difficulty when swallowing, ear pain, a lump within the neck or throat, persistent pharyngitis or cough, voice changes, especially hoarseness or not speaking clearly, congestion, swollen lymph nodes, patches and open sores. Symptoms will depend upon the sort of cancer. An individual with hypopharyngeal cancer might not have symptoms within the early stages. This will make it harder to identify. Other conditions can cause these symptoms. However, if they persist or are severe, an individual should ask a doctor to see them to rule out a significant condition. Advanced symptoms of throat cancer. The three main sorts of throat cancer, laryngeal, hypopharyngeal and oropharyngeal, which incorporates oral cancers, share many common symptoms. Many symptoms of throat cancer don't develop within the early stages of the disease. Signs of throat cancer may first be found by a dentist or doctor treating another disease or condition. Common symptoms of throat cancer include persistent cough, difficulty swallowing, a lump within the mouth, throat or neck, hoarseness or other voice changes, ear or jaw pain, white patches or sores within the mouth or throat, difficulty breathing, headaches, unexplained weight loss, swelling of the eyes, jaw, throat or neck, bleeding within the mouth or nose. Some symptoms of throat cancer are specific to certain areas of the body. As an example, voice changes could also be a symbol of laryngeal voice box cancer, but they might rarely indicate cancer of the pharynx.
I hope you are enjoyed watching this video about health issues. Comments, likes and share. Subscribe to our channel and learn more about new things. If you have any problem related to health, then you will contact health issue page.